ABC assessment with these guys. The first thing we do is check our airway, and that is where we're going to bring this dog's airway up to that neutral position. Because again, if his chin is tucked all the way down, or his chin is tucked all the way down to his chest, he may not be able to get a breath in on his own. If we pull it up and we listen, we check for our breathing for 3 to 5 seconds, we can put our hands here and feel. That's going to help us tell. And again, you want to count out that at 3 to 5 seconds. Dogs breathe about once every 3 to 5 seconds. So count out your Mississippis. 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi. He's not breathing at all. What do you think I need to do for him? Okay. Give him 2 breaths. So I'm going to close his nose and mouth. And this is your dogs really shouldn't have plastic coming out of their nose. If they do, we have a really big problem. But in the case of the CPR dog, this allows you to practice on a sterile environment every time. So, I'm going to give him 2 breaths. Okay, there's no breath, so I'm going to go check for a pulse. An easy way to check for a pulse is the inside of the back leg. But there are other places. Where else can we check for a pulse on a dog? Who knows? Yeah. Up on the back of their paw. Yeah. Any place for a large artery. Those of us who work in the medical field and have to do sticks in their neck, you know, if you're really good, you can palpate the carotid in their necks as well. But for the most part, it's really simple to check a pulse on the inside of the back leg. Why? Large artery close to the skin. Easy to palpate. A couple of things to remember when you're checking for pulses. Don't press really hard. Because if I press really, really hard and they have one, I'm probably occluding it. So you have to have a real gentle touch when you touch. I tell people 2 or 3 fingers, just gently palpate. So I'm going to try that right now on yourself. Find your thumb where it comes to your wrist and place 2 fingers there. And just gently palpate around until you find your own. So you want to use your 2 fingers and not your thumb. And it's not that people say, oh, it's because our thumb doesn't have a pulse. Well, only if you want to cut it off your body. It does. Your thumb's more calloused. So it's not as, you don't have as gentle of a touch on your thumb as you do on your fingers. Everybody find your pulse? Anybody here not have a pulse? That means you see Myra's not sure. She's like, I'm not sure if I have one or not. So we're going to check that pulse for 5 to 10 seconds. 5 to 10 seconds. No less than 5 seconds, no more than 10, because we want to be sure. If you don't check pulses every day, can you be proficient at it? So here's your homework. All of you go home, find a pet, any pet, yours or your neighbor's, and find it and check for a pulse. Check for a pulse. Because it is better to check before an emergency and become proficient than not know at the time. So here's your homework. Go home and gently palpate pulses.